Call the meeting to order. Please stand for the Pledge of Allegiance. Good evening. Session of the study session and a regular meeting. As city clerk, to record attendance.
Mayor and council members, when I call your name, please respond with present. Wendell,
Present.
Tilton Byrne,
Present.
Niemeyer,
Present.
Corbett,
Present.
Collins,
Present.
Brink,
Present.
Bacon.
Okay, thank you. Council entertain a motion to approve the agenda.
So moved. Second.
A motion, any discussion? Comment? Please call the roll.
Wendell,
Aye.
Brink,
Aye.
Collins,
Aye.
Corbett,
Aye.
Niemeyer,
Aye.
Tilton Byrne.
Aye.
Okay, the agenda is approved. We begin now with the study session. The public comment is not allowed at a study session. The intent of the study session is for the city council and city staff to discuss items and presentations. All right, with that said, I turned over to the city manager to begin a discussion on the study session.
Thank you, Mayor, City Council members. I'll wait. Bonnie will go ahead and advance the slide here. Go ahead, one more slide. There you go. For tonight, I'd like to give you a quick update of what's in the packet when it comes to the regulation that's before you tonight. Additionally, on the call for tonight, we also have Bonnie Specker as well as Daniel Scholl that would like to say a few words as well. So before documents that are within the packet, Ordinance 21-012 is currently the mask mandate and occupancy regulation, which is a continuation of what we have today and is set to expire right now until April 10th. The ordinance that's within the packet has it as an emergency ordinance for another 60 days. Ordinance 21-013 is the mask mandate only. It does strip out the occupancy and other items and transitions the occupancy and some of the regulation governing businesses into recommendations, with the exception of employees within bars, restaurants, salons. Then also any city permitted items also are bound by the mask regulation as well. So once again, it's just a mask mandate, 21-13. However, it does transition the occupancy language into recommendations. The final item before you is the resolution 21-024, which takes all the language and puts it into a recommendation rather than regulation. This was requested at the last meeting, so therefore it's the third item before you today. Bonnie, if you'd go ahead and advance one slide. Thank you. Some of the things that council should consider as you're making your decisions, and some of the things you'll hear from some of the presenters tonight include the impact of individuals coming back to Brookings from spring break and the various places they've been. The new variant here in South Dakota. Not all the vulnerable individuals in this community have been fully vaccinated. And there are some small increases in cases that occurred over this last weekend. We had a day of 10 and then another day of 12, but I see that the numbers are slowly decreasing as well. So hopefully that's just a little blimp on the number of cases. We have transitioned to moderate last week, and then we transitioned back up to substantial because of that increase in cases. So hopefully we can get back to that moderate here before too long. And then, of course, the council did have a brief discussion last week and probably further discussions on transitioning to a resolution that ends regulations. I included on the bottom of this slide for the public and for council to see where we're at as percentages. This was given to me last Wednesday, so as soon as I get an updated list, I'll make sure and share that with the public as well as council. I'll just read these real quick. 80% plus that have been vaccinated is at 95% here in Brookings County. 75 to 79%, or 70 to 79-year-olds, 72%. 70 to 74% have been vaccinated is 87%. And 65 to 69, 76%. I will tell you, last week at the pod, we had roughly, I believe, 1,300 that were vaccinated, which is an increase of about 250 from the previous pod. And so those still seem to be going very successful. And I know that some of the pharmacies are now giving the vaccine as well. Bonnie, if you transition to the next slide. Thank you. I did not include this in the packet, but hearing and talking further with some of our medical professionals, I thought I would lay out a potential amendment that council might want to consider tonight. So before you, you'll see in March, I circled the 2 dates. Right now, we're at the 16th, which is the study session. We'll have a regular meeting tonight. You'll hold your first hearing on the first 2 ordinances I explained earlier, and then you can discuss the resolution, pass it, table it, do what you wish with the resolution. Next week, March 23rd, we'll hold the second hearing for those 2 ordinances. And at that point in time, council can determine what ordinance they would like to pass, if any, or pass the resolution. You can also amend if you're going to make any amendments tonight. So therefore, this would count as your first hearing, and the city attorney can walk you through what that looks like and how it works for us, or works for council, if that should be the chosen route. So I put on this map, or this calendar as well, April 10th. That's when the current ordinance expires. Bonnie, if you'd move forward just a little bit. What I would recommend to council is to continue with the transition of all the public hearings and table the resolution, have a little discussion, but table it to next week for further discussion. If you can click one more time, Bonnie. I would recommend that council consider at next week's meeting the mask-only mandate and stripping out the occupancy requirements and expiring the ordinance April 30th. Bonnie, can you hit one more time? Sorry, I put too many transitions in this document for you. If you see the red circle here, I was told by mid to late April, just about everyone who's vulnerable in Brookings will have had the opportunity to obtain the second shot. That means that by the end of April, those most vulnerable will be fully inoculated. And therefore, if we're trying to protect those most vulnerable, I would recommend that the ordinance for mask only would then expire April 30th at the end of the month, and April 27th, council can then consider the resolution that's being presented tonight as well. Transition everything into a recommendation versus the requirement. Then at the end of May 31st, council can let it expire, or at any point throughout this period, council can bring back the required occupancy requirements up to the April 30th if we should see a spike in cases. Or after April 27th, and on April 27th, the council desires not to even have a resolution, you can just let things expire, or any time throughout that period, council can adjust that resolution. Bonnie, if you can go one more. So if this is something that council would desire, I would recommend tonight, as you have the regular meeting, you open up the public meeting hearings, you go to close it, I would recommend amending both ordinances to expire April 30th, so it could meet that timeline that I just presented. And then the resolution on the mask, the resolution that would take all the mask and occupancy regulation to just recommendations, take action on that April 27th. Once again, council can judge based on the actions of this community where we sit, and then increase or decrease at any point in time. But I thought this was kind of an opportunity to bring everything together that I'm hearing from council, from a resolution to ordinances, and then transition out based on the vaccinations that we have going on here in the community. With that, I'd probably turn it over to Bonnie Specker, because I believe she has a presentation, and then we can come back and answer any questions you might have of the information I presented today.
Thank you, Paul. I just wanted to talk a little bit about the results or some discussions that the members of the Public Health Advisory Committee that does the City Threshold Weekly Report, we meet every Friday afternoon, and we discussed tonight's meeting last week on Friday and came up with this presentation. We're not speaking to the business or to politics, and we just want to present the health, science, and data related to this, and the council can take into account the business side of things. One of the things we wanted to emphasize is that the pandemic is serious, especially in South Dakota. We've had the 8th highest number of deaths per population in the United States out of the 50 states. No country outside of the United States has a higher number of deaths per population size than South Dakota. So South Dakota has been hit pretty hard by this pandemic. Next slide. And I wanted to emphasize what had happened with the cases following the previous ordinances. This is a slide of the cumulative cases of the 10 counties with the most populous cities. And you can see that prior to September, Brookings was pretty much right in the middle of these 10 counties. But during October, when the state experienced a surge in cases, you can see that with the steep rise in the number of cases in most of these counties. Brookings really didn't see that as steep a rise as the other counties. And we've ended up having the lowest number of cases per population of these 10 counties and also the lowest number of deaths. Next slide. And this graph shows the weekly number of cases. The last blue bar there was last Wednesday. We're now above substantial spread. So it was dropping until about a week ago, a little bit more than a week ago. The week ending March 10th, we were up to 31 cases. So far this week, we're up to 37 cases, and we'll have a new one of these graphs tomorrow. And as Paul mentioned, we are now in substantial spread. Last Wednesday, we were in moderate, but that's been now increased to substantial. Next slide. Also, Paul mentioned the vaccination rates. This was as of last Monday, where we had 18.5% of the county population older than age 16 immunized. As of today, on the Department of Health dashboard, that's gone up to 24%. So it is increasing quite dramatically, mainly because of the pause, I think. Next slide. So Brookings County has what now substantial spread. 10% of the residents have tested positive for the virus as of last Wednesday. And among residents 16 years of age and older, 19% have received at least one vaccine. Many of the people who have received the vaccine also may have tested positive previously. So there's roughly 40, anywhere from 19% up to maybe 40% of the population that would be immune to this virus. It's really hard to estimate what that is exactly. But the conclusion is there's still a lot of susceptible people out there, and that is what the committee was really concerned about. Next slide. The good news is, and again, as Paul mentioned, the age groups that have the poor outcomes have a high percentage vaccinated. As of last week, 72% of the 80 plus and 67% of the 70 to 79-year-olds, this is statewide data, not county data, had received at least one vaccine. The vaccination percentages, however, do drop off significantly at ages below 70. That slide is in the weekly packet if you want to look at the vaccination percentages by age. But the long-term effects of COVID are reported in some of these younger ages, and we didn't feel that now is the time to forget about the public health recommendations. Next slide. And those recommendations that the CDC has released are wearing a mask, socially distancing, avoiding crowds, washing your hands, avoiding poorly ventilated spaces. Everyone on the council has probably heard this so many times they probably dream about it. Next slide. So the advisory group really recommended waiting one more month to see where Brookings is. I think there's a concern that we still have a large percent of the population that is susceptible. If we limit the cases, this will lead to reduced hospitalizations and deaths. We've really done well basing decisions on science and data. And we strongly feel that the best way to herd immunity is through vaccination. This herd immunity, that sort of the magical numbers used to be that 60 to 75%, but with this new variant, if it does take hold in South Dakota, that percentage that's going to need to be vaccinated is going to increase. We didn't feel that we were quite there yet, but we are getting close. That's all that the committee wanted to mention. So thank you.
Thank you, Dr. Specker. Dr. Scholl, did you have?
Yes, I would, Mr. Mayor. Thank you very much for the opportunity to address the council in this study session. What I'd like to do is to share with you where we are in our planning and response at SDSU and what our near-term outlook is, so as to continue to foster the excellent partnership between the university and the community that we've experienced to date. As many of you may know, and is documented on the SD State website, we have reduced our safety level from orange 1 to yellow. The implications, there are numerous implications of that, but I think the most important point is that strict guidelines for use of facilities, public use, teaching, research, and other work-related interactions, our guidelines are still in place. Face coverings are required indoors, interactions are distanced or with protection barriers. Decreased density principles are still applied in offices, laboratories, studios, and other university spaces. We still encourage virtual interaction among people. However, residence hall de-densification is still in place, but there's more flexibility for students for mobile food ordering and carry-out being encouraged. The key point is that, or the key difference between safety level orange and yellow, where we are now, a one-step reduced safety level, is that the maximum occupancy or maximum participation for events is now based on the ability to maintain physical distancing during the course of the event, whereas previously we had a maximum capacity for non-university sponsored events of 60 individuals. Travel is permitted beyond strictly mission critical travel, but travel is conducted following strict protocols. Commencement is the next big step, the next big thing for SDSU and the SDSU community. And we are excited and committed to the goal of having an in-person commencement. But in order to reach that goal, we will have to maintain control over the spread of COVID-19 in order to safely carry out such a landmark event. And that control depends on preventing infections among our students and our employees, both or as they interact and conduct their business both on campus and off campus. So we still have control practices in place for decreasing or controlling the risk of infection as a means of supporting our students, our employees, and the community wherein they interact. A couple things I'd like to highlight. First of those are testing. We continue to run an internal drive-through COVID-19 testing site for students the same day or at most next day results. There's a stepped up high-frequency testing for students and staff that are in high-contact settings as part of the programming that they're following at SDSU. We conducted a pre-spring break campaign for testing, and there was good uptake of that by students leaving for spring break. And we are in the midst this week of a post-spring break testing campaign with testing incentives. And we got off to a strong start yesterday for that. But we're still too early in the week for me to be able to give you data on how extensive and effective the uptake or response to post-spring break testing is. But we think that this will be important for getting us from now to commencement. Vaccination. SDSU staff are meeting regularly with officials involved in vaccine management to provide the maximum support and implementation capabilities that we can, both in support of the community and in achieving vaccination targets among our citizens. But with respect to vaccination, we're very conscious in our decision-making of some things that we don't know yet. We don't know, for example, how effective the vaccines are against variants. We don't know in great detail yet how effective the currently available vaccines are at preventing the spread of COVID-19 infections. And we really don't know how long vaccinated people have this effective resistance against serious disease. The implications of those things that we don't know yet is that it's still appropriate to apply basic prevention steps for both vaccinated and unvaccinated people. That includes, as Dr. Specker said, that includes maintaining 6-foot distances between ourselves, wearing masks, avoiding crowds, avoiding poorly ventilated spaces. So to sum it up, we are exercising judicious engagement and activities aiming to prevent spikes of COVID-19, especially before graduation, and in the community and among the business patrons that serve our university population. And I'd be happy to answer questions to the extent that I'm able to that the council may have about what we're doing and what we're seeing in the university community. Thank you.
Yeah. Councilmember Brink.
Hi, Dan. I had one question for you, and maybe I missed it, but when did SDSU change from the orange to the yellow rating?
That's a good question. I believe that was week before last. It may have been early last week.
Thank you.
Any other questions for our speakers? Okay, thank you, Dr. Scholl. Council have any other questions of any of the speakers? You ready for me to close the study session and go into the regular meeting and have these discussions, or anything you'd like to discuss? Okay, well, I'll close the study session. We'll go into the regular meeting. You might notice something up there, a nice little box up there, and that helps us limit the time because we want to ensure that everybody that wants to speak has that opportunity to speak and can be heard. And so when a person comes up to speak, the green light will come on, and at 1 minute, the yellow light will come on, and then at the end of 3 minutes, the red light will come on and the person's done speaking. So we're going to give that a shot tonight. So with that said, call the regular meeting to order, and we'll open the forum. Anyone care to speak to a topic that's not on the agenda tonight? Okay, I'm going to close the public forum. We'll begin the ordinance first reading and turn it over to the city manager.
Thank you, Mayor, City Council members. As I mentioned earlier, the current ordinance is set to expire April 10th. Tonight, Council will hold the first hearing to extend the current mask mandate and occupancy regulations. On March 23rd, the second hearing will be held. Staff does recommend amending this current ordinance to expire April 30th. The current regulation requires 50% occupancy at restaurants, bars, groceries, casinos, and gyms. Employees in restaurants, bars, grocery stores, salons, barbers are required to wear face coverings when social distancing cannot be achieved for all indoor businesses or indoor public spaces. Staff does recommend holding the public hearing at the March 23rd meeting.
Okay, thank you. Council, comments, questions?
If I could make a
Yes,
comment.
please.
I think for purposes of clarity and given the fact that we only have 1 week, I guess, prior to the second reading, if we do desire to make any changes to this ordinance, such as revising the expiration date, I think we should move to approve the ordinance and also then amend it if that's the council's desire. I think for purposes of clarity, we should have that level of formality. It's not required, but it is permitted under our ordinance to have a motion to approve, a second, discussion, public comment, and amendments would be in order at that time.
Okay. Well,
Mayor
I'll
Corbett,
Yes, go ahead.
as long as this falls in line with what Mr. Britzman just said, I would motion to approve the first reading of ordinance 21-012 with an amendment ending the ordinance April 30th.
That is
Second.
permissible. Do we have a second?
Second.
Okay, Councilman Wendell, second. Now, council discussion on this, or we'll open to public comment? Councilman Collins?
I just want to make sure I'm clear. This is the ordinance that we wear the mask and we have 50% occupancy, right? And if we vote yes on this, this just lets it expire?
If you vote yes on this, this would then amend the ordinance, and this would count as your first hearing, and the ordinance would then expire April 30th. But you have your second hearing next week, so it all depends on the action you take next week.
Thank you.
Mm-hmm.
Can I ask for
Mayor
another?
Corbett,
Can I
Councilman
ask
Wendell
for?
had it first, so.
Thank you. I want to make sure as we're having a conversation around ordinance 21-012, in a moment we'll have a conversation around 013, correct? Our action on this doesn't preempt any action on the following. Okay.
Correct. Now, Councilmember Tilton Burn.
just for further clarification, voting yes on this will not pass this ordinance. It just approves the first reading.
That is correct, Holly.
Thank you.
Okay, any public comment on the amended ordinance? Seeing none, close public comment. Council, you ready to vote? Okay, Bonnie, please call the roll.
Bacon,
Aye.
Brink,
Aye.
Collins,
Aye.
Corbett,
Aye.
Niemeyer,
Aye.
Tiltonburn,
Aye.
Wendell.
Aye.
Okay, ordinance 21-012 is amended. Oh,
No, it was amended on the initial motion.
right. So this is done. We're ready to move on to 21-013?
Correct.
Okay, thank you. Okay, now ask city manager to introduce 21-013.
Thank you, Mayor. Ordinance 21-013 is an ordinance that just contains the mask mandate, and it also requires plastic dividers in retail between customers and employees at the checkout, as well as employees of certain businesses to wear masks, including bars, restaurants, salons, and other similar type businesses. It does take out all the occupancy requirements and makes it into recommendations rather than requirements. As noted before, staff does recommend amending this to expire April 30th, as you did with the last ordinance. Doing so, holding the first hearing tonight, then you'll hold the second hearing next week, give you the opportunity to determine what ordinance you want to move forward with.
Thank you, and I should have mentioned that there will be, as you said, second reading on 21-012 next Tuesday night on the 23rd. So, okay, we have motion, we have recommendation. Any motion from the council?
Mayor
Councilman-
Corbett,
Yes, Councilman Wendell, looked like you're up. Oh, okay. Yeah, Councilmember Tilton Burn.
I would motion that we approve the first reading of ordinance 21-013 with the amendment that it expire April 30th.
Second.
Okay, Councilman Niemeyer had second. Any public comment on? Council comment, questions? Okay, Bonnie, please call the roll.
Brink,
Aye.
Collins,
Aye.
Corbett,
Aye.
Niemeyer,
Aye.
Tiltonburn,
Aye.
Wendell,
Aye.
Bacon.
Aye.
Okay, ordinance 21-013 is amended, and second reading next Tuesday on March 23rd. Ask City Manager to speak to Resolution 21-024.
Thank you, Mayor. City Council members, this is the item that was brought forward at last week's City Council, and it's a resolution that takes all the City Council ordinance or regulation in the ordinances, and it makes it a recommendation for mask and occupancy. So there's no legalities behind this. Once again, it would be in place for 60 days. This was brought forward as a request by City Council. City staff does recommend tabling this item to a future meeting.
Okay, council, what's your thoughts on this?
I'd like to table it until the next meeting.
Till the 23rd?
Second.
Okay, we have motion and a second to table the resolution till the next meeting on the 23rd. Council- City
Because
Attorney.
because we're tabling this to a specific date, there can be discussion concerning the appropriateness of tabling it until next week.
Thank you.
And another point of clarification, Steve, if we still would have the option to table it a second time, correct?
That
If
is correct.
We talk about it next week, we could table it
Okay.
for a third time. Thank you.
Good. Okay. Any public comment on tabling resolution 21-024 until next Tuesday night? Council comment? Councilman Niemeyer.
So I know we're just talking about the significance of table. Are going to ask the public here is to read all three of these, and I would really appreciate public response in the next 7 days. I think we all need to have decisions not only on our own but from the public. I think the public needs to chime in on this, and feel free to email, call, write letters to the city, whatever you got to do. We need to hear from the public, see where they're sitting on this. Thank you.
Okay, thank you. Any other council members have?
Another comment on the comments, actually, because I'm not sure if my iPad is working like others, but when I looked on the website today, Bonnie, I could see that there were numerous e-comments made from the commenter's point of view, but when I look at my iPad, I see one, and so I'm not sure that I'm getting everything, and so that's one question I would have. So I'm not sure if others are seeing those comments.
Actually, Councilmember Brink, I only see one public comment that was made in the system, so I will look into that and respond back to you.
Okay, I'll send you a screenshot of what I was looking at because it showed several people that had made comments, but then only one was showing in the actual body of the agenda.
That would be great. Please share that. Thank you.
Okay, thank you. And then further, I was just going to make a comment again about, we're up here debating mandates once again, and we've been doing this all along. And I appreciate what Ms. Becker said in her presentation. We are being provided with guidance and professional information from the medical community and the scientific community, and we're grateful for that guidance. And that guidance is helpful, and we appreciate that. But our job is about more than just listening to that one perspective. Our job is bigger than that. We cannot afford to just simply think about physical health in its perfect state at the expense of every other aspect of life. And so it is incumbent upon the council that we take the information and we use it to make the best possible decisions for the best possible common good of all of our residents. And a couple of things that have now changed since we put these mandates into place, we now have, nearly 20% of our population that has had at least one vaccine. And what's notable about that population is it is primarily the older population with more underlying conditions, more vulnerable and at-risk population. So if the majority of those people have now received vaccinations, that to me is a change. I would also just note that I came across today something that actually came from, I believe, a CDC publication. It came from the Morbidity and Mortality Weekly Report that is on the U.S. Department of Health and Human Services CDC website, March 12th, 2021 edition, Volume 70, Number 10, that is a CDC study about the effectiveness of mandates on the transmission rates of the virus. And so what this study showed is it tracked different counties in the United States between March 1st of 2020 and December 31st of 2020, and it looked at the rates of transmission and death rates, and then it analyzed after mandates went into place and then saw the effect on those rates. And this is a CDC publication, to my knowledge, and it said that mask mandates were associated with an average of a 1.32% decrease in the growth rate of COVID-19 cases and deaths in the first 100 days within those communities. So, look, I'm not a scientist, but I have not seen any peer-reviewed academic studies about real populations in South Dakota that has specifically studied the effectiveness of mandates on changing the population's behavior, which then leads to potentially a decrease in rates. And so I've never been, as I've mentioned multiple times, anti-mask, anti-science, none of that. I believe that the scientific method is so robust that it can withstand and should encourage robust questioning and testing of everything that it says. If you look at some of the doozies in human history, we used to think that the earth was flat. We used to think that we revolved around the sun. People used to get burnt at the stake for not having the right beliefs. The point is, science is a process of questioning. And so questioning is appropriate. And so that is an attitude that I've tried to bring into my analysis, a healthy skepticism, but I won't say a skepticism that overrides other information. I believe that the sum total of all of these behaviors likely helps us out, and that's why I'm following them myself and following them in my family. However, I just don't think that we should have this set of behaviors codified into our local laws anymore at this point in time. So I just wanted to share the reason for last week's request, and that I do think that we're at a point where if anything is going to allow us to start to relax here, I think we're there.
Okay, thank you. Anyone else? Okay, looking ahead to next Tuesday night, it's going to be a full one. So we'll speak to several items on the consent agenda.
Excuse me, Mayor.
Yes.
We have a motion to table to the next meeting. We need a roll call.
I'm sorry. All right, thanks, Bonnie. All right, any more discussion? All right, please call the roll.
Collins,
Aye.
Corbett,
Aye.
Niemeyer,
Aye.
Hilton Burn,
Aye.
Wendell,
Aye.
Bacon,
Aye.
Brink.
Aye.
Thank you, Bonnie. She gets tired of keeping track of me, but anyway. All right, so looking ahead to next week, number of items on the consent agenda. Open forums and presentations, Development Disability Awareness Month, recognize retirement of great city employee, presentation by Mr. Meyer on the BMU water treatment upgrade. Oh, and Eric with him. SDSU Student Association report. We have ordinance and first reading, a vacancy of a lot, and an ordinance on code amendments. Second readings on rezoning 2 areas, and then the motion to bring back ordinance 21-004, which was on 20th Street South, and then per our action tonight, ordinance 21-012, ordinance 21-013, ordinance 21-04, and other business will have the City-County Government Center agreement and a financial report on the Brookings Health System, progress report by the Assistant City Manager, COVID-19 update, and then an executive session. Anything else you'd like to add to that or future regime? No, Nick? Okay. Anyone else? City Manager?
Not for the agenda, but I just wanted to comment to the public and people watching at home that we are still in need of volunteers for the next 2 pods for March 25th and April 8th. We are short on volunteers for those 2 events. So anyone who's interested in participating, ask that you get a hold of Brookings Health at brookingshealth.org. We do have specific email that you can email as well. If you feel like contacting us at our city offices, 692-6281, 692-6281, we'll be more than happy to hand that out to people interested in volunteering.
Great. Thank you. Anything else, Council? Entertain a motion to adjourn.
So moved.
All in favor, say aye.
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 We're adjourned.